I want to go ahead and get us started into today's topic. We decided to talk about depression, loneliness, and the importance of connection, knowing that in particular, one of the reasons it came up was we know the holidays are often great and joyous and lovely for everyone, and people love the winter with the snow and the skiing, but some people don't. Some people don't have a great holiday. They're alone maybe for the first time. Maybe family wasn't with them. Maybe they get the winter blues and the doldrums from the cold. And it's a natural thing. So we wanted to discuss that and kind of put that out there to folks as well. So that is our topic for today. I do have two lovely women with me, two doctors who will be doing our expert panels with us. And I am going to let them go ahead and introduce themselves when we get to that. I did just want to do two really quick housekeeping notes. We do, though this is a webinar, we do encourage you to use the functions that should be on your toolbar for Zoom, and that is the chat. It's kind of a little box with a little thing like coming out. I don't know how to explain that, coming out of your mouth. Please do use that. I will keep an eye on it, as well as maybe both Sandy and Tracy will, to ask questions. There is also an option by your name. You can also do down below, there is a raise your hand option. I will also keep an eye on that. That also allows you to verbally ask your question. And both Sandy and Tracy are encouraging questions, so we will have little bits afterwards to encourage those questions, and then again at the end. So please do take advantage of that. As much as I said, this is a webinar with panelists, we do want to make sure that your voice and your questions are heard. That is kind of it from me. So I am going to go ahead and turn it over to Dr. Tracy Lepard.
Thanks so much, Tanya. It's really a pleasure to be with you all today. I'm Tracy Lepard. I am an internal medicine and geriatric medicine physician practicing at Kaiser Permanente. I practice at the Longmont office. And what geriatrics means is that I specialize in caring for adults as they get older and oftentimes start to accumulate a few different medical conditions over time. It also means I get to spend a lot of time with a truly lovely and remarkable group of people. I get to hear very interesting life stories, and I really get a chance to learn from their wisdom. So I'm here to talk with you all today about social isolation, loneliness, and the power of connections. And I'm going to share my slides now. So hopefully in just a moment, you'll be able to see this come up. And are you seeing my slide deck?
Yes, thank you.
Excellent. So let's just start with some definitions here. Social isolation is the objective absence of contacts and interactions between a person and a social network. And loneliness is more of that subjective feeling of being alone, being separated or apart from others. And we really think about this as an imbalance between your desired amount of social contacts and your actual amount of social contacts or quality of social contacts. And I'd like to just read a little excerpt from a book called Together, The Healing Power of Human Connection in a Sometimes Lonely World that was written by Vivek Murthy, who's the 19th Surgeon General of the United States. I have this book listed at the end of my slide deck as a reference for you. It's a really excellent book. But I think that this little excerpt really sums this up nicely. Unlike the feeling of loneliness, which is subjective, isolation describes the objective physical state of being alone and out of touch with other people. Isolation is considered a risk factor for loneliness simply because you're more likely to feel lonely if you rarely interact with others. But being physically alone doesn't necessarily translate into the emotional experience of loneliness. Many of us spend long stretches by ourselves when we're so involved in our work or creative pursuits that we don't feel at all lonely. On the other hand, we can feel lonely and emotionally alone even when we're surrounded by other people. What defines loneliness is our internal comfort level. This is what makes loneliness different from solitude. When we feel lonely, we're unhappy and long to escape this emotional pain. Solitude, by contrast, is a state of peaceful aloneness or voluntary isolation. It's an opportunity for self reflection and a chance to connect with ourselves without distraction or disturbance. It enhances our personal growth, creativity, and emotional well being, allowing us to reflect, restore, and replenish. So, solitude is really that state of being alone without being lonely. And it allows you to really have that time to reflect, and it's restorative. It's something that we choose. We're really social creatures at heart, and social connections play such a vital role when we are facing tough challenges. Togetherness really raises optimism and creativity, and when we feel like we belong to one another, our lives are stronger, richer, and more joyful. So, how common is loneliness? This was a survey in 2018 that was conducted by Kaiser Family Foundation, which is not at all related to Kaiser Permanente. But they found that 22% of adults in the United States struggle with chronic loneliness. And they noted that that's more than the number who smoke or the number who have diabetes. So it's really common. And I want to point out this was in 2018. Well, we all know what happened between 2018 and 2024, and that's the pandemic. And what was the impact of the pandemic on loneliness? Well, I'm sure none of you are surprised to see that the pandemic really increased the prevalence of loneliness. And in some studies, loneliness is now present in up to 43% of older adults. So it is exceptionally common to experience. And just like Tanya said at the beginning, the holidays and the winter season is oftentimes one of those times that people tend to feel the loneliest. So loneliness increases all sorts of health risks. People who struggle with loneliness have a greater risk of cardiovascular disease, dementia, depression, and anxiety. And Dr. Aman will be talking about this a little bit later in terms of the connection to depression. So, relationships between loneliness, anxiety, and depression are really, they're complex and they're reciprocal. So it kind of creates this vicious cycle where loneliness can be associated with increased depression, and that increased depression further increases loneliness. People who are depressed oftentimes will socially isolate and feel just that much more lonely. So loneliness can also be a symptom of depression. So it's connected in so many different ways. And the thing that's interesting is, I think, oftentimes we do screen for depression, and we are definitely screening more for loneliness and social isolation. It's important to really screen for both because the treatment of both is very different. Whereas with depression, you might treat with therapy, with cognitive behavioral therapy, with counseling, with medications. Loneliness, you treat differently, and I'm going to get into that just in a little bit. And there's all sorts of symptoms that can also kind of, create um, sorry, I keep getting these little pop-ups. Loneliness, other symptoms, pain, sleep disorder, substance use, chronic diseases such as diabetes or limitations in activities of daily living can all absolutely compound all of the problems with both loneliness and depression, and really create a lot of complexity. Studies that have been done have looked at the association between loneliness and risk of mortality or shortening of the lifespan. And it's very interesting to note that the impact of loneliness is similar to the impact of smoking a pack or three-quarters of a pack of cigarettes a day, and greater than the mortality associated with obesity or sedentary lifestyle. So as a physician, I think about all of the time I spend encouraging people, helping them with quitting smoking, with losing weight, with becoming more physically active. I really should be spending just as much time, if not more time, talking about loneliness and things that you can do for loneliness. One of those things is developing comfort with solitude. So really being comfortable with solitude is an essential part to strengthening our connections to ourselves that allows us to strengthen our connections with others. I wanted to talk through a few things that we can do to help with this. So the first thing is mindfulness. And I really like this little cartoon where you see the dog, person and a dog, and the dog is really just living in the moment, just aware of the beauty of the walk that they're on and where they are. And the person just has this mind filled with all of the things that that we think about as human beings. And it's really important skill to quiet the mind and to be able to be in the moment. Some of the things you can do are meditation. Just simply being in nature is very restorative for many people. Eating mindfully, so eating slowly where you're really savoring things, noticing colors, smells, sounds, textures, flavors. And all of this really allows us to be fully present in the moment. And if you don't mind indulging me, I'd like to just do a brief meditation with all of you right now. This is something that I sometimes will do in the office if somebody comes in and seems particularly anxious. Their blood pressure may be up a little bit, and we'll just do a minute or two breathing meditation. So just find a comfortable position. Sitting down in a chair is just fine. And if you feel like closing your eyes, you're welcome to do so. Certainly not necessary. And we'll just kind of go through this. So, no matter what's going on in your life right now, no matter how many thoughts are racing around your mind, no matter how your body's feeling, just take a moment to sit down and take a big, deep breath, breathing in through the nose and out through the mouth. As you breathe in, a sense of taking in fresh air, lungs expanding. As you breathe out, a sense of letting go of stress in the body and the mind. Just feeling the muscles soften and relax. One more time, breathing deeply in through the nose and out through the mouth. Just take a moment to pause. Allow thoughts to come and go. And then just gently opening the eyes again. And I don't know how all of you are feeling after that little minute or two of just taking a moment to pause, but it always is very centering and calming and relaxing for me. And it's the sort of thing you can just kind of build into your day anytime you need just a little moment to remember to be in the moment. The next thing that I wanted to talk about that's a really nice strategy to use is three good things. And some of you may have heard of this before, but really it's a very simple practice of gratitude. Sometimes people will just have a little notebook or a little journal that they can write in. But I encourage you to try this for just 2 weeks. It takes 3 to 5 minutes to do this. But every night, every evening, maybe before you go to bed, before you're kind of calming down for the night, just take out your notebook and write down 3 things that you're grateful for. And just include a little specificity around that. It's nice to just have something that you noticed and really write that down with a little degree of detail. Just has to be a sentence or two. It doesn't have to be a novel. And anything counts. It can be something big, it can be something little, it could be the gratitude you feel for your partner, your child, it could be the experience of seeing a beautiful bird in a tree, a funny squirrel out in your yard, really anything. And try this every night for 2 weeks and just see if that gives you kind of a different perspective on life. Um, and then the third thing that I think is just really important is volunteerism, because we really are wired to be social, and our brains reward us from a neurobiological standpoint when we join forces with others to do something good, to accomplish something positive. And doing good makes us feel good. So it provides us with that sense of purpose, of joining together. And people who volunteer report better health and greater happiness than people who do not. And that relationship exists even when they control for socioeconomic factors and things like that. Um, I have another little excerpt that I wanted to read from Together. There's this evolutionary theory of loneliness that's rooted in the observations that humans have survived as a species, not because we have physical advantages like size, strength, or speed, but because of our ability to connect in social groups. We exchange ideas, we coordinate goals, we share information and emotions. Our strength is our ability to communicate and work together. And I think that volunteerism really kind of gets at the heart of that. And then I think it's important to talk about the connections that we have, and really how we can nurture those connections. So we really have kind of these three different layers or levels of connections. We have this inner circle. These are close friends and confidants. These are the people that we could call for help at 3 o'clock in the morning if we needed them. We have this middle circle. These are occasional companions that have shared activities and interests. Maybe it's a group that we belong to. And then we have our outer circle that are just acquaintances. These are, maybe the grocery cashier that you typically see, or the neighbor that you run into on a walk. And they really form these little micro connections that make life a whole lot more enjoyable. And I'm gonna, again, just read a little excerpt to get at this. So we all need close friends and intimate confidants with whom we share deep bonds of mutual affection and trust. We need casual friends and social relationships that offer shared support and connection. And we need to belong to communities of people, neighbors, colleagues, classmates, and acquaintances with whom we experience a collective purpose and identity. Within our inner circle, we rely on a small set of people for protection, support, and sustenance. We're wired to devoting a whopping 60% of our time and energy to our inner circle friends and confidants. Most of this is spent with our closest intimates, who rarely number more than 5, and it can just be 1 or 2. The middle group, these are friends that are not the first ones you turn to for support, but they're likely to lend a helping hand if we ask them, and vice versa. They're buddies we spend time with a few times a year, the old school friends and relatives we reach out to during the holidays, the well-wishers we inform about marriage or the birth of a child, and the neighbors we meet over dinner. And then the outer circle. These distant relationships don't have the degree of openness or vulnerability that characterize closer friendships, but just the flicker of recognition and a welcoming smile help us feel known in a subtle and meaningful way. Familiar people make us feel welcome. They help us feel rooted in place. The last slide that I'll share with you is just some further reading if you're interested. I really do like this book by Dr. Murthy. I think it's an excellent read. There's Project Unlonely, Healing Our Crisis of Disconnection, and then the most revised and updated version of Bowling Alone, The Collapse and Revival of American Community. So I think that those are really the key points I wanted to get across to you, and I am happy to open this up for questions and answers at this time, or turning it over to Dr. Mon, whatever makes the most sense, Tanya.
I do have, Clark, I saw that you had your hand raised, so I'm gonna put a little thing that gives you that moment to talk if you'd like. Um, and then if Clark is doing that, I did see that in our chat. I did have a gentleman ask thoughts regarding too much meditation.
I don't know that I've seen anybody have too much meditation. Meditation is a very easy thing to titrate as you need to, and some people may need a little bit more meditation than others. Um, I think that a little bit of meditation goes a long way, and so it's a practice that I personally practice in pretty small bites. I rarely have the time or the mental capacity to do more than 3 to 5 minutes of meditation at a stretch. But I do find that even those little, meditation snacks really, really helps me. So I don't think you need to spend an hour in meditation to get benefit from that, although there are people that really do. And if that works for them, that's wonderful.
Thank you. And then Clark, did you want to ask your question?
I just want to point out that Facebook is a wonderful place to post gratitudes. I'm very difficult to understand because I've ataxia.
Okay. Do you want to try to type it, Clark? Is that helpful or? Well, thank you, Clark.
Yeah, thanks for being on today.
Does anybody else? I'm not seeing another Q&A and I'm not seeing another hand raised. Dr. Mon, do you want to take over?
Yes, I can do that.
Thank you.
Mhm. All right, hopefully you can see my screen.
We are good.
Okay.
And again, I will keep an eye on the Q&A and the chats and we can open those up at the end.
Great. I am Dr. Sandra Mon. I am a mental health consultant and a therapist in private practice. I have experience running mental health centers and ran them during COVID and in a lot of the changes and expansion of our mental health crises and our this growing challenge around loneliness and isolation. And I'm really grateful to Dr. Lepard for demonstrating that as a physician in the medical fields that we can integrate whole health and think about all the different aspects of what makes us healthy. And so I'm grateful for you today to share with that. I will move forward with my presentation. I'm going to talk a little bit about mental health concerns in general, and then kind of focus a little bit on depression since it's one of the most common mental health conditions in the United States, and part of what we're talking about today. And then I'm going to talk a little bit about things that when you notice that is becoming something that you need support in, and how you can reach out for help. And maybe some of the things that might keep you from doing so and ways to mediate that. So some of our most common mental health conditions. So I mentioned depression. So mood that also includes bipolar disorder, or having a balance between more manic or elevated mood states with more depressive states, which can show up as irritability or sadness. And we'll get into a little bit more of those symptoms as well. Anxiety, that can show up more generalized with worrying and ruminating about a range of concerns to moments of panic or fear that can lead one to even believe that you might be having a heart attack or some sort of health emergency. As well as social anxiety. Some people can even get to a point where it's hard to leave their homes for fear of what might happen outside of their home, or other kinds of more specific phobias or fears. And these issues become more problematic when we start to avoid certain things that we might enjoy or derive benefit from because of those fears. Or the symptoms of anxiety. Obsessive compulsive disorder. This it can look in a lot of different ways, but it can be oftentimes ruminating or thinking things that cause great concern and doing engaging in some sort of behavior that helps you to feel more at ease or in control of those thoughts. So it might be counting or checking, for example, that can kind of slow you down or consume a lot of your mental energy. And then post-traumatic stress, having experienced trauma, and things that can trigger that newer experiences. I think we can also experience vicarious trauma through watching news, and especially in today's world with so much being captured in the media, lots of visual images and stories and narratives that can even trigger experiences that we might have had some time ago. So other things I think of note are addiction, such as engaging in substances or gambling or overeating. Grief and loss can also play into these pieces, eating disorders. And as Dr. Lepard talked about, the aftermath of COVID, and a lot of these types of symptoms can really co-occur with one another and just become activated by the social cultural environment that we're in. So talking a little bit about depression. We've all seen those commercials about depression. We might have also experienced depression. We all experience it in different ways. There's no one right way to experience it. It can look like any of these things. So it could be low energy, or loss of interest in things that you used to enjoy. So really feeling like you just don't want to engage in the world or with others, and see others as kind of enjoying themselves, and you're feeling pretty much out of that, or not able to connect with that joy. Distance or disconnection from others and life overall. So again, that kind of separation. Trouble concentrating, focusing, even on this presentation, right? We're meeting for close to an hour, maybe less, depending on how long this goes. And maybe having difficulty focusing and concentrating for periods of time. Coping with stress. So having a shorter ability to respond, maybe be feeling more irritable or short-tempered, or having a harder time accessing those things to help, like even the idea of knowing meditation or taking a moment to breathe could be helpful when you're in that, in a depressed state. You might have a hard time even thinking about that as an option, and putting that into use. So it can really confine or limit our cognitive thoughts and our brain capacity to be able to deal with the world. Eating and dietary changes, weight changes, impacts on one's self-confidence, feeling about yourself and how you're presenting in the world, issues with relationships or work, or within your community, and sometimes using substances to mediate some of those experiences or escape some of the unpleasantness of these experiences. I think grief, this idea of existential loneliness or maybe disillusionment in the world. And it can even be at times fantasizing about what it would be like to not be alive anymore, thinking about one's end of life a lot more. And that can become, that can be a normal thing to do and can be an understandable thing to kind of wonder about and prepare and plan for. But it can also be consuming and have a kind of a darkness surrounding it that can lead one to maybe even take steps either passively, like to not engage in things that are going to help you to be alive and engaged in the world, or could even take more active steps to harm yourself or even kill yourself. And sometimes we don't talk about those things because that can be very scary to think about or can be taboo. But it's important to be able to speak about those thoughts and feelings if that's something that you experience, because ignoring that or not talking about it is not going to make it go away or make it any better, and could put you in a vulnerable position to not get the help and support that you need. I think when do we know when these experiences of these symptoms for any of these mental health conditions become a problem that we need help for? And I think we think of three different areas. So severity, how serious are these symptoms, and is it keeping you from getting out of bed? Is it keeping you from engaging or connecting with other people in ways that could benefit you? Is it keeping you from maintaining a healthy weight or getting exercise or whatever those things that you would normally do? And is it really impairing your life in some way? Persistence, how long this goes on for. It can sometimes be something that, has an up and down cycle. It can be something where we feel like we never get really high, or elevated in our mood, but we're always feeling pretty low. And then sometimes we even dip further. And so it can be kind of a bumpy ride, and figuring out what that looks like for you and your experience, or for those around you that you might be concerned about. And then pervasiveness. Usually we look for whether or not these symptoms are happening in one or more area of your life. So is it happening at home mostly, or in your personal life? Is it happening in a work setting or a learning setting? Just really trying to understand the variables that come into play with these symptoms and what impacts that. I've kind of alluded to stigma before, but stigma being, the things that get in the way from us talking about mental health concerns, sharing our mental health concerns with other people. There can be a lot of guilt or shame around doing so, even when so many people experience some of these symptoms, but we don't really always know because we don't talk about it so much. That can lead us to be under-resourced or feel more isolated or disconnected from others. And so it can also lead to, folks who experience mental health conditions can experience bullying more. They can experience harassment. They can feel discriminated against or rejected from sort of social experiences. And that can really compound the experience of depression and that isolation and disconnectedness. People who are experiencing mental health challenges can feel misunderstood by others, can avoid or delay seeking help. Also, we can not engage in seeking help or therapy, or even going to your primary care physician to mention these things. Because of inadequate health coverage, or finding that we just can't afford to pay for this extra thing that's not covered by our insurance or that requires these additional costs or efforts because there's barriers to accessing that care. And then I think also ways that we can reduce the stigma, sharing and outreaching with others. So when we are experiencing these symptoms, to talk about that. When you're seeing your primary care physician, to talk about how you're feeling in some of these experiences. It's not just about the ailments or the health conditions that you're coming in for the appointment for. We really should be talking about all of these things. And we should talk about that with those closest to us and those who might be able to help us. We should also outreach to people who maybe are on the periphery or feeling seemingly disconnected and who we think might benefit from having a listening ear, or who might be struggling with something and we just don't know. We can sometimes experience others that we don't know as being kind of short or not smiling or not seemingly friendly or more distant. And if we don't know them, we might imagine them to, oh, that's not a very nice person, or that person might be rude. And it's possible, but it's also very common for people who are experiencing some sort of deep distress or mental health concerns to present in those ways. And that may be opening ourselves up if we are practicing more of that gratitude, if we are taking care of ourselves and can see others and witness, maybe giving them an opportunity to connect can be helpful. Educating and empowering others to understand that that mental health looks all different ways, and that we can take steps to receive support and help and understanding, and dismiss some of the misconceptions about mental health that maybe keep us at a distance from folks who are struggling. And then normalizing and equalizing those opportunities to get care. So when we hear someone struggling, to maybe we've felt that way before and we can talk about that, or maybe we can connect them with someone else who we know has felt that way. And sometimes engaging in community settings where others have experienced these things can be really helpful, such as group therapy or grief counseling, grief groups, things like that. I think there's various ways to help improve our mental health. What I don't have on this list specifically is medication, but certainly that is studied and effective for people. But I don't think it's necessarily always the first line. And certainly what we're talking about today, connection. And that's not just showing up and being in a space together, it's actually engaging and connecting and being with. And so oftentimes that means putting yourself out there a little bit, sharing something about yourself, having a shared experience with others that's a bit more active. Even being vulnerable in some way to sharing something about yourself that you might not always share. Physical activity, healthy diets, getting sleep, kind of those basic things that can be hard if we're experiencing stress, healthcare concerns, if we're a caregiver for others. And some of these things are, taking care of ourselves takes a lot of energy, and many people could improve on the way that we take care of ourselves. And myself included, I know that there are certain things that go when I'm under stress quickly. I may not reach for the right healthy foods. My sleep is going to be impacted. And I'm probably not going to get the amount of sort of exercise that I know would be helpful. And so it's really sometimes reflecting on kind of where you're at and reminding yourself, and sometimes doing things that don't feel like the easiest thing to do in the moment, but that will help you. Having opportunities to learn and engage our brains and minds can be really helpful in combating mental health symptoms. Having enough leisure with the stress, to kind of balance things out, having moments for contemplation, similarly like meditation and mindfulness, as Dr. Lippard talked about, having kind of that space for allowing your mind to contemplate your day or things that are of meaning to you without having to brush things off or rush through things so much. Giving to others, actually volunteering or mentoring with others, as was talked about, it can be really helpful in combating some mental health concerns. I think a big reason why it does is that we can get outside of our own selves, right? We can look at others and have kind of a change of perspective. And sometimes we learn that, wow, there's others that are struggling too, or maybe in harder way than what I'm dealing with right now, or wow, I had no idea that people would struggle with these things. And it can really change up one's mindset. And then, of course, psychotherapy. So, going about finding a therapist when you get to the point where you know that, it's time to try out seeking therapy, or maybe you have someone close to you that you think could really benefit from talking to someone, but you're not really sure like how to get from, okay, I'm open to doing that, to taking all the steps to do it. It can feel like a maze to go through, right? And there's things to think about in terms of like health insurance. How am I going to get to the appointment or pay for the appointment? How do I know if I'll like that person or what their approach is? And all different kinds of things can come into our minds that can create barriers for us or make it harder for us to get through those steps. So I have a few steps here that I suggest to you if you're interested in seeking out treatment, is to first make a list of something that's important to you. You might have a short list. It might not matter so much, or you might have some particular points about, I really need this person to be a particular gender, or it's really important that they have some sort of life experience, or that they have this specialty around this issue. And making a list of those things can help you kind of focus in a little bit more on what it is that you're looking for. And then seeking out a list of referrals. That can be from your primary care doctor, friends that might be seeking therapists, your insurance provider. Oftentimes you can get a list of providers in your area or who approach certain specialty areas, and then start there. Or you can use some sort of online search platform like Psychology Today, for example. There's tons of things out there now. In fact, that can be overwhelming in and of itself to know which one to hit. And then from there, cutting down that list a little bit. So maybe it's by geography, or whether or not you're interested in participating in telehealth or in-person services. What payer source you're going to use. How important is it to use your insurance? Do they take your insurance? Or can you pay out of pocket? Do they offer sliding scale if you need to do that? Specialty, any kind of other identities. And then to choose kind of the fit. So you might have referrals to a center where there's a number of providers there, right? If it's Kaiser, oftentimes you'll have an opportunity to be in network and have connections and providers recommended by your primary care physician or someone else that's treating you there. And so having a sense of, if you're going to someone who's an individual private practice, so that would be myself now, you're going to connect with that one person, and it'll be whether or not they have availability or they need all these other pieces. And that's going to be best for general outpatient care. You're not typically going to have medication management as part of that, or other kinds of services, like maybe group counseling or other, kinds of case management supports. Whereas you might find that more so in a center or a kind of one-stop shopping kind of healthcare setting. And then I recommend consulting or screening a few providers. You might find a provider right away, and the first person you contact meets all the criteria and you like how they engage with you. Or you might want to try out a few others if you don't have that strong feeling that like this feels good. And that's okay. It's both directions. You're screening someone, you're screening a therapist, just like a therapist is screening to find out whether or not they're a fit for you, and the best person to treat you with what you're bringing in. And so that's important. And then there's ways to schedule online oftentimes, and then there's other ways to, connect with the provider, in real time and on the phone, or via a virtual connection, or even in person. And so I would just encourage folks to give it a try, if that is something that you're leaning towards, and not to give up, right? Sometimes you do have to repeat the steps and to try to contact additional providers. And it can be hard to do if you're really struggling. Sometimes we help other people when they're struggling to get the help, to get connected with therapy. So those are all my slides. I am a virtual therapist. I am a clinical psychologist and work with adults and older adults over telehealth only right now. And I serve Kaiser patients, as well as patients with Medicare and Medicaid and Anthem, Blue Cross Blue Shield. It's important to me to think about access to care, as I've said before. And I believe that there's always an opportunity for people to access care when they need it. So I will stop sharing my screen.
Thank you. I do just have when you said that we can always access care when needed. And I guess it is often expensive. It can be. And I know you did kind of address that. Can you talk about that a little bit more? Like, does insurance often cover this, or, what are some of the, I guess, alternative type therapies when financially it just, actually seeing a therapist is just really not in the cards when it comes to financial?
Yeah, that is a good question. I think I've seen a lot change in mental health in the past decade, and definitely in the last 5 years. I think I believe very much that mental health and counseling should not be something that is a luxury only some people can afford. It's really important that we all have that access. And so what should be happening is that insurance companies should be covering mental health benefits, behavioral health benefits, which includes substance use and mental health, just the same as they do for physical medical conditions. It is not 100% always the case, and sometimes we have to inquire or press in those ways. I have seen a lot of folks who can use their health insurance if you find the provider that's in network, and sometimes even out of network, and a provider can provide what's called a super bill, and then you pay for it out of pocket, and then your insurance will cover some of it. That's not always easy for people to do, to upfront those costs. There are also places that will provide sliding scale services. And so even, as low as what a copay would be. So it could be $20, $40 a session, which for most people makes that possible. And then there are centers that will go even lower than that. So there's always those options. And it's just a matter of finding, does this person, this therapist take my insurance, or I can afford it? do they understand or have experience, can support my specialty or area that I need? And then geographically, or via telehealth, does that work for me?
And there are a lot of telehealth options as well, right? When it comes to like all health these days, you don't need to necessarily leave the home. Or,
Right. It's
yeah.
expanded care so much, and kind of given us a window into the lives of one another in I think really meaningful ways.
Tracy, I know you provided some resources, and I did have a gentleman just ask if, are there other, like, can either one of you, and it doesn't even have to be right now, and maybe send it to me and I can send it out afterwards, just more online resources that maybe people could look into or, you know, look up and use that might be helpful in addressing some of these, you know, just some of these, you know, whether it's the loneliness, depression, fatigue, that type of things.
Yeah, I would be happy to give you a list of some online resources as well. And I would totally agree that there are lots of virtual care options these days, which I think really has been very beneficial for people who it's hard to get out of the house sometimes. Transportation can be an issue. I mean, there's all sorts of things. The other thing I'll say is, if you have a primary care doc, please talk to them. In my office at Kaiser Permanente, we're really fortunate to have behavioral medicine specialists, therapists who are right there in primary care with us. So I can literally see a patient and have them go right around the corner to see the therapist that I work closely with. And it's just really nice to have it right there in primary care because it is primary care. That's kind of how I view it as well.
Thank you. Does anyone else want to do a raise hand or ask some questions? I'm not seeing any. This was great. This was chock full of information. And then again, if you can provide any extra resources to me, I'll get those out into an email to everyone. I did record this. So the presentations that both Dr. Mon and Dr. Lepard's presented are on the recording. I can also just send those in the email, the presentations to everyone. But you will get that recording and we'll put that on YouTube. And again, if both doctors are able to provide a little bit more information or resources, I will gladly send those on. And I also encourage all of you is if this ends, and I hope this is okay with the both of you, but if you send me questions that kind of popped into your head afterwards, I will gladly pass them on to both of them as well. So I don't want this to end. I think it was very clear that it is an important topic. And both doctors were very clear that it is an important topic and it should be a part of ongoing discussion. So please don't let this stop just because we're stopping this little talk. Again, thank you for joining. I'm still not seeing anything else being addressed. So thank you to the both of you. I really do appreciate you being on today.
Thank
So
you
much. It was a pleasure.
Take care. Thank you, everyone.
Bye-bye.